Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD, Doctor of Medicine in Ayurvedic medicine subject, that is Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharira subject. This is a series called as a Ayurveda in GP, Ayurveda in General Medical Practice. So this series is very useful for the medical students, medical doctors, medical professors, and also to aware that this particular different problems, the common man is also educated with these all types of the conditions. So I welcome you all. Today's topic is not that we are going to treat in the general medical practice, but we must know, okay, these are the causes for unconsciousness. In Ayurveda, there are different terms to describe the different stages of unconsciousness. Sometimes there may be only drowsiness, sometimes there may be semi-conscious, then there will be consciousness, and then there will be coma also. My dear friend, this is related with the nervous system. And when the patient is not responding to your sensory stimuli, that is called as unconsciousness. So this nervous system examination, a very interesting topic, but many students, many doctors, many professors, and the common man feel, oh, this is something very, very difficult. But I request all of you, there is a playlist in my channel called as a clinical examination. Professor Dr. Deshpande has prepared fantastic videos how to examine nervous system, how to do the pulse examination, how to do the cardiovascular system examination, how to do the respiratory system examination, this and that. So you go and check all the demonstration fantastically in easy language, but in a scientific way. I have given a demonstration. So today, this topic, you must see the how to examine the sensory system, how to examine the motor system, how to check the reflexes. Reflexes are very important topic. How to understand the general, what you can say, orientation of the patient, whether the patient is aware of the time, space, and person. He can identify the person, he can get stimulated, he can awake after proper stimulation. Usually we give the stimulation over here, or we squeeze the Achilles tendon above the plantar aspect near the ankle joint. Achilles tendon, we squeeze it. And if a patient is not reacting, or here we press it seriously and pressurely, and still the patient is not any get reactions, then that person can be said to be unconscious patient. Of course, we do the simple auscultations and the blood pressure very fastly, and then we ask the patient to shift the patient, because unconscious patient may need some very detailed examinations, laboratory investigations like blood examination, then what you can say, the CSF, cerebrospinal fluid examination. So many things are expected, ECG, MRI, sonography, everything should be done very, very fastly. And these all the things should be available under one roof. So I request, whenever in GP or in any house, if you find unconscious patient, in spite of doing here and there, better phone immediately to the 108 in at least Maharashtra, India. There is a best ambulance service by 108. So you can call any ambulance nearby hospital. And this particular preparation has to be beforehand. That means आम्ही मराठीमध्ये असं म्हणतो, we in Marathi language say, आग लागल्यानंतर बंब बोलवा. So whenever there is an emergency, 11th hour, and then you think of this thing, that is not at all correct. So you should be planned in your family members, in your relatives, in your colonies, in your societies. Everybody should be trained with respect to the emergency management of any patient. Try to understand. So mishap can happen with anybody's house, with anybody person. So all the members in the family, all the members in the society, they should be little bit trained about these basic facts. This is, for example, cardiopulmonary resuscitation, CPR technique. When the heart has stopped, how to start pumping. That video is also there, artificial respiration. My dear friends, so this is not related. Oh, okay, this is not my concern. Doctor will see this video. No, my dear friend. Everybody should understand the medical knowledge because our health is wealth. So let us start to discuss about unconsciousness. So I am giving you the most important causes in medical practice that because of that factor, the patient has to be admitted because he is unconscious, not responding to your stimuli. First is epileptic. Everybody knows epilepsy is an electrical defect in your brain. So EEG, most of the times this patient is a known case of epilepsy, convulsions, clonic and tonic movements, first stiffness and then convulsion, stiffness, convulsions. Only few minutes, 2 or 3 minutes. Mostly it is maybe grand mal epilepsy or petit mal epilepsy. But then when the patient is unconscious, known case or unknown case because of the epilepsy, one has to admit and see whether it is a trauma, accident, and anything else. So this patient should be admitted. Epilepsy in Ayurveda, it is called as apasmar. EEG and MRI of the brain is very important test. Then next is a meningitis or subarachnoid hemorrhage. Both the things are different, my dear friends. I am sorry, it is not or, actually it is and, it should be and. They are separate. Meningitis is an inflammation to the meninges. The coverings of the brain are called as a meninges. And when they are inflamed, that is meningitis. How to diagnose this patient? It's very easy. Mostly this can happen in the children. So high fever, like here, you can test very, very high fever, then there may be projectile vomiting. Vomiting will be there, but it will go on the long distance. Projectile vomiting, severe headache, unbearable headache, and then stiffness of the neck. Try to understand meningitis, stiffness of the neck. So if we bend and try to touch this chin to the my GP sternum bone, the patient will not respond, or he is so stiff at the neck muscles. So this is a neck rigidity. Neck, NECK, rigidity is very important sign for meningitis or even subarachnoid hemorrhage. And another important is related with the plantar aspect, foot. But here, just for demonstration purpose, I am consider this is a palmar aspect, palmar aspect, foot. Okay, and then we have the clinical hammer. Doctors have the clinical hammer, not simple hammer. So one has to scratch the blunt end. For example, this is my blunt end of the clinical hammer. This is already in the video. Check the video of clinical examination. And if I move from the heel up to the toes will automatically bend forward. That is a normal, physiological, no problem in the patient. But in this meningitis or subarachnoid hemorrhage, this particular, when we press like this, in spite of coming like that, toes will go loud. Fanning of the toes. This is called as Babinski's sign. Babinski'. Babinski's sign is positive. In spite of bending toes like this, they will be fanned out. FANNED, fanned out. This is dangerous signal. It indicates there is a damage to the brain. Immediately admit to the patient. Don't waste time, because cerebrospinal fluid examination, higher antibiotics, intravenous antibiotics, everything is needed. Mostly subarachnoid hemorrhage is also common in the hypertensive patient. Normal BP 120/80 mm of Hg. Mercury, Hg is mercury. Okay. Even digital blood pressure apparatus you must keep in your house if there is elderly people living, or even the youngsters. Anytime you can just, there is no need of the doctor. You have to just put it over here and pumping will be there, automatic. And if we press the button, one day I will show you that how to use that digital apparatus. But that is very important, very essential. Like for example, if the diabetic patient in the house, you must have glucometer. Blood pressure patient is there, you must have the digital blood pressure apparatus. So if the blood pressure patient don't take single tablet, that can make havoc. Blood pressure shoots, and that makes the bleeding in the brain. Many times subarachnoid hemorrhage, the patient may die instant death. So be careful about the blood pressure tablets. Don't miss the single tablet, number one, and don't stop immediately. For example, sometimes the patient is frustrated with the allopathic side effects and all this and that, and they are very crazy. Now I will go for Ayurveda, I will go for homeopathy. I don't want Ayurveda, allopathy. And then they stop the allopathic anti-hypertensive medicine immediate, and then Ayurveda or homeopathy starts, but it takes some time. So meanwhile, the blood pressure can shoot. Even you can bring the tablets minimum 15 months or 1 month ahead. By chance there is some unrest in the society, banda, then all the shops are closed. Then you must have the stock enough, because I have seen such cases. They are not taking proper care, and then blood pressure shoots, subarachnoid hemorrhage, death. So be careful about blood pressure. Hypoglycemic coma, same thing, same mistake by the diabetic patient. They are careless sometimes. I am not talking about each patient, but many of the diabetic patients are not serious about their disease. I don't mean that you should be a very serious face all the time. No, you must make a friendship with the diabetes, but you must check your blood sugar very regularly in the pathological laboratory, fasting and postprandial, after food, and after food exactly after 1.45 minutes, not before and not after. Very, very particular. But in addition to that, you must check minimum after 3 months glycosylated hemoglobin, HbA1c. Most important investigation for diabetes, because that can give the average for this patient. For this hypoglycemic coma, I have one request to all the diabetic patients. If any time by chance, if you are having diarrhea, loose motions, gases in the stomach, and you don't want to eat, you are senior citizen like 65, 70, 80, 90, and you feel you are on insulin, or oral hypoglycemic agents, and one day you feel that I am having a constipated gas or loose motion, and today I don't want to eat, and you don't eat even. But still, if you are taking the medicines, still if you are taking the insulin, danger. You may suffer from low blood sugar, hypoglycemic coma, deep unconsciousness. In diabetic patients, two possibilities: hyperglycemic coma or hypoglycemic coma. If the blood sugar more than 500 milligram per cent in the glucometer, sometimes they don't show any reading, only E, only this alphabet E. You don't understand what is this today. Reading is not coming on glucometer. Whether cell has damaged, whether my instrument is faulty, is not giving the result. But no, many glucometer has having a setting. For example, it can record only 500 milligram, it can record 600 milligram, and when it goes beyond that, it shows the sign E, that is emergency, admit the patient. So hyperglycemic coma is also possible, and hypoglycemic coma is also possible. But what is more dangerous, if you ask me? Hypoglycemic coma, write down, can be fatal. It can take your life, dead, within 5 minutes. Yes. Check whenever you have the suspicious, doctor, but how we can understand that the patient is going deep into the hypoglycemic coma? 2 or 3 simple things I will try to explain you. If you have any diabetic patient at home, please always check whether it is on glucose, whether he is on insulin, whether he is on oral hypoglycemic agents. And then at any time, while looking the TV, while discussing with you, while reading the paper, when he is alone, and he, look my face, I am making acting like drowsy. and you are asking him, Baba, क्या होता है? हाँ, हाँ, So this type of slurred speech, little bit what you can say, uneasiness on the face and the body, and the most important, full sweating, full body sweating or forehead sweating, but more sweating. Sweating is not. Clothes are wet here and here. Sweating is there. Sweating. That sweating and uneasiness indicates, check the glucometer immediate, and you will find the blood sugar 60 milligram. Oh my God, 50 milligram, 40 milligram. This person can die at any moment. Any moment. So be careful. Be careful. Uneasiness and lot of sweating, only two things you must remember. Uneasiness and lot of sweating, hypoglycemic coma or heart attack. Hypoglycemic coma or heart attack. Always shift the patient. But for hypoglycemic coma, I will tell you, you just take a glucose mixed with the water, glucon-D powder, immediate, always should be in the hand, in the room of that elderly person, diabetic patient, and mix it and try to give sip by sip if he's conscious little bit. Or if he's not, then just rub on the tongue, on the gums, that saturated glucose solution. Are you getting my point? And call 108 and move. Because in hypoglycemic coma, see what I'm saying. When he receives IV intravenous glucon or glucose, like a magic, like a miracle, he will start talking like nothing has been happened. Like nothing has been happened. In this way, immediately he come out of the danger. He or she may come out from the hypoglycemic coma. Hypoglycemic coma, if given intravenous glucose, is totally 100% reversible and instant like a magic. But I'm sorry to say, if little bit late here and there, unnoticed, patient can lose the life. This is hypoglycemic coma. Hepatic coma, possible in the jaundice patient, possible in alcoholic patient, possible in the cirrhosis patient, hepatitis A, hepatitis B, bilirubin level too high. Are you getting my point? Bilirubin too high. This hepatic is the liver. So hepatic coma is also dangerous. If the full coma exists, most of the times the patient can die. So you must find out pre-hepatic coma. Diagnosis like a pre-hepatic. Warning signals. Simple 2 or 3 things I will tell you. If the bilirubin level is too high, yellow colored urine, yellow colored eyes, and then non-alcoholic, if one day he starts like a tremors, and the patient having the sleep rhythm changed, in spite of night, getting the sleep at night, he is sleeping whole day, and night he is awake. So this change of the rhythm of the sleep, tremors, this indicates that the patient will land into the hepatic coma, which is not reversible. I'm sorry. Patient can lose his life. So hepatic coma is very essential to diagnose. Space occupying lesion in the brain, SOL, maybe tumor, maybe just like I have told that hemorrhage may be there, but the most problem is a abscess, tumor or something like that. Okay. Then poisoning by a TIC-20 or opium. This is one of the reasons. Pontine brain hemorrhage. Then Dhatura poisoning. Stroke. Stroke is a hemiplegia, paralysis because of the, like our heart attack. This is called the brain attack. Heart attack, brain attack. So in all the cases of heart attack or the brain attack, first 4 hours after onset, very crucial, very important. If you can diagnose this brain attack or the heart attack, and if you shift the patient in the intensive care unit within the period of 2-3 hours, you are successful. Yes, you are successful because you can save the life. After immediately admission, doctors start the treatment like saline and intravenous antibiotics. But most important is thrombolytic treatment. Whatever the obstruction, thrombosis is dissolving like injection streptokinase, urokinase. These type of the medicines can be given and the conditions can be very well controlled. Otherwise, like a whole life, hemiplegia or paralysis will take place. So my dear friends, heart attack and the brain attack, that is a stroke, that is a hemiplegia, must be diagnosed early and shift the patient as early as within the golden hour, that is 4 hours from the onset of first symptom. Okay. Alcohol poisoning, uremia, yes, it can be diagnosed very early. Kidney patients, maybe nephrotic syndrome, maybe acute glomerulonephritis, maybe acute pyelonephritis, chronic pyelonephritis, dialysis. Always keep a watch on the blood level of urea and creatinine, because this doesn't happen in a single day. Gradually it is increased, and one day urea level is so increased that these toxins spread in the blood, and that is uremia. So this uremia coma is very dangerous. Then diabetic coma, I think I have discussed. Hyperglycemia is also creating barbiturate poisoning by the sleeping pills. My dear friends, as per treatment, I have always mentioned that just to diagnose is important, rest will do in the hospital. So always call for an ambulance and try to hospitalize patient at the earliest. You may, Ayurvedic doctors, Ayurvedic Vaidyas, they can a little bit give supportive treatment by making a paste of Hemagarbha Matra and just licking on the tongue. So every 10 minutes till the shifting to the ICU, this can be done if at all he has, Dr. Vaidya has some experience with this Hemagarbha Matra. So my dear friends, this is a very short but interesting video regarding the causes of unconsciousness. And I hope you have liked this. So don't forget to like, share and subscribe my YouTube channel. We'll see you in the next video. Till then, I wish you all the best. Take care. Thank you.